Welcome back to the channel. My name is Sebastian and I am running this YouTube channel for purposes of education. Background, I am a paramedic. I've been doing EMS since 2008. I have been board certified between the years of 2018 and 2022 as a critical care paramedic. And I went and had about 68 credit hours completed of 68 of my physician assistant school and worked from East Coast to West Coast. In today's video, I'm going to be discussing the new NREMT format. If you guys have any other questions or concerns about my background and where I'm coming from as an educator or a tutor, you can follow through with my vlog number 1. And we are doing everything live. Okay, so everything is raw and uncut. And I just have too much going on to do a bunch of rendering, too much going on to do all the editing, things of that nature. So I'm gonna make sure we're focused here. And last episode or last vlog, I discussed the common denominators that students approach me with whenever they need assistance with tutoring. And one of those things is putting together the pieces of the puzzle for the scenario-based questions. What I've expressed is a couple things. One of those things is that when you spread yourself thin using a bunch of resources such as the quiz websites or assessments, practice exam websites and modules and all the businesses that have their feelers out for students to come and invite them on board with some type of subscription, you have to be careful because some of the questions in the question bank may not be directly evidence-based or used by NREMT, which NREMT is by natural selection is going to use the most up-to-date information pertaining to medicine and trauma. And those particular organizations that immediately ring a bell are going to be those organizations such as the American Heart Association, okay, any type of nursing transport. I think the ASTNA, it's the Nursing Transport Association. They're going to be using things like your NREMT in some cases for your critical care paramedic, right? Your ICS straight from CAMS. So all your regulatory bodies is kind of where you need to have your face in that book. Even your EMT basics, right? So advanced life support, basic, advanced life support, pediatric, advanced life support, basic life support, all of those are AHA. Okay, so just be careful because I've noticed that they'll leave information out of the questions and it will force you to abstractly kind of guess and imply, and that's not the way you want to be approaching the new format or any of the standardized tests. Okay, really quick, I want to get into a whiteboard with you and explain how we break down a scenario, because there's a lot of students who have problems with this. And so we're going to start here with a screen share. Okay, I'm going to come to my whiteboard here. We're going to screen share this whiteboard. If we screen share this whiteboard, we're going to see that I use something called IT. Okay, and what this is I've taken from my experience from medical school and I brought it back into paramedicine. Realize that when you go and do your EPCRs, which are electronic patient care reports, you're going to find that they want you to use a variety of different types of documentation, whether it be SOAP, right, which is your subjective, objective assessment and plan, whether it be chart, okay, so your chief complaint, your history, okay, your assessment, your RX, I always say, which is your treatment, your transport. You can also use the chart, which is my favorite, which is the dispatch, the arrival, and then chief complaint, history, assessment, okay, then your medications or interventions, transport, and then exceptions. I like to use the chart because it gives me a more holistic remembrance and recall of the entire call. Because I could put things in the exception, whether I be delayed on scene. I could put things on arrival, what I seen, who was there, what was said, okay, any conflicts of interest, any type of drama, I put in that exceptions, any lack of insurance or things that the patient has done, such as hit you or make some type of crude remarks, I put those down in the exceptions or down, somewhere in that area. And so if there's problems, unjust problems that are occurring with bystanders, things like that. Okay, so when you look at all of those documentation components, and then you go to school, you realize that things are kind of algorithmically in place. And what happens is a lot of the students, they'll go to school, and then the instructor will give them, or the professor will give them a book. But the book's format is not always in a train of thought, kind of like most of your physician desk references, like Medscape, okay, or e-medicine, Hippocrates, Up to Date, Merck's Manual. All of these things are references, and you'll find on a reference, typically you'll have at the very top a tab somewhere, or even horizontal or vertical, and there would be almost an algorithmic approach on how to tackle that particular emergency. And so that really, when I came to paramedicine, it really helped me kind of congeal everything, because when you're at the level of medicine and you're at the mid-level or higher, you have this responsibility to maintain a lot of information. Only way to do that is to categorize that information. And so coming back to the pre-hospital side, I came up with IT, and we're going to go back to screen share. Now, screen share on this whiteboard is a little new, so we're going to take our time and kind of go through it, but I think we're going to be okay. So when we're looking at our emergencies, right? If you recall on last episode, I said you have two types of emergencies, and it's always the same. And this is why NREMT for years had either your medical or your trauma emergencies, right? And so when you're going into your books, there's a lot of trivia, right? There may be trivia about interventions. There may be trivia about certain steps of labor. There may be trivia about the GCS. So there's trivia everywhere. But a lot of students will get caught up on the scenarios, not understanding how to approach those. And the problem is that they don't have the hallmark understanding or rudimentary understanding of the emergencies that are given to them, or the selections in this case, the multiple choice. The reason why this is an important conversation is because now we have a new format. Not only will you have to choose one, but you will have to choose many, okay? 2 to 3 possible choices. So when we're looking at the I here, okay, the I, the first I, our thought is going to be, let me see if I can get my eraser. There we go. Is what does I stand for? I'm going to bring the I down here. And I stands for identify. Okay. All right, identify. And for all your emergencies, if you're really good at this IT method, then you should be able to work a scenario relatively easy, and I'll explain why. So the first thing, there's 4 pillars here. The first thing you want to do is understand the definition of the emergency. So let's just say I'm talking about hypertensive disorders of pregnancy. Let's just say HTN, hypertension, and we're going to say specifically preeclampsia. Okay, preeclampsia. Okay. All right. So when we're looking at preeclampsia, immediately the definition stands out that this patient is in a gestational state at the time, gestational metabolic state, meaning she's pregnant. And the concern is that there's a rising blood pressure, okay, which by definition, which is our D, we have a blood pressure that is elevating. Typically, they're concerned when it reaches at 140 systolic. Okay, that 140 systolic. Okay, so the definition there. Know the definition of what it is, right? Hypertension in the gestational period. Okay, and when we say to ourselves, well, why is this happening? This is our fourth pillar. And the why is important for the levels of EMT advanced and EMT paramedic and your board certification, whether that be FPC, even tactical, community, you name it, CCPC. Okay, that's more of the pillar that you want to kind of look into and understand for those emergencies, because that will help you kind of navigate a selection of more difficult or moderately difficult answer choices, specifically at that level of board certification. Okay, so why would preeclampsia be occurring? Well, there's a lot of medical and traumatic emergencies out there, and when it comes to medical, there's a lot of these emergencies that the etiology is unknown. But recently, I was investigating, and basically the placenta is not anchoring into the uterine lining sufficient enough to meet those metabolic demands, or sufficient enough to prevent preeclampsia, obviously. So preeclampsia will occur due to the fact that this anchoring process was not as efficient and not as sound as a normal pregnancy. And this is secondary to multifactorial reasons, such as genetics, such as drug or smoking, such as stress, and things like malnutrition, okay, can cause this poor anchoring of the placenta, leading to third or even second trimester development of preeclampsia. Okay, so the third pillar is going to be your assessment, which is your physical, I call it physical exam. Okay, your physical exam / assessment. Okay, so physical exam assessment, what am I gonna see on preeclampsia? Well, one of the most pertinent things that you can see on your signs of the patient would be something such as pedal edema, or even edema of the hands. Okay, pedal edema. All right. And you may also see, obviously, with your vital signs, which is the fourth pillar, all right, you will see that systolic, all right, that systolic, okay, around that 140, right at that 140 or higher. Now, when it comes to, let's take and headaches, right, headache. So these are your four pillars. Now, when we're looking at vital signs, I want to go back to blood pressure really quick, because this is how you tie in and you start making connections as a growing provider, like as a growing student. And you start putting together why things are happening, and it brings you to that next level. So if you're going into nursing, or you're going into med school, or you're doing something to maybe even a horizontal transition to an allied health field like respiratory therapy. Okay, we're talking this systolic here is the topic that's of concern. Once your blood pressure starts to reach a certain threshold, meaning it reaches a certain level, and it can be high or it can be low. And this is why the systolic number 90 is important. And in this case, typically the systolic number of 140 is important for a gestational female. And that's because you have the capillary membrane pressures, right? And you start getting these pressures either too high or too low, right? The porridge is either too hot, the porridge is either too cold. Okay, remember the body needs homeostasis. So if you're getting numbers too high or too low, oftentimes it's not meeting metabolic demand to offload or onload the basic constituents of life. Okay, whether that be offloading of CO2 or offloading of lactic acid, whether it be onloading oxygen, okay, and nitrogen. And so this symptomology, if you will develop as the pressures start to escalate. And these are the four pillars that you just naturally want to be thinking of. And if you're in a higher level, let's just say you're at a higher level in our EMT or NREMT, you would also see something down here, such as labs, right? You would see on physical exam assessment that the labs would have proteinuria, okay? And so you would consider that as well, okay? Proteins, okay? I'm just gonna put that like that. Okay, so as you start to escalate up to paramedicine and you go into a scenario, you might be involved with having to pick through different type of gynecologic emergencies or obstetrical emergencies, okay, in this case. And so I would consider these four pillars: understanding the definition, okay, understanding why it's happening, and specifically on scenarios, this area right here, physical exams, assessment findings, okay, vital signs, okay, is going to help elicit what we need to do up here, which is the second T, okay? So let's bring the second T down here, or the first T, I should say. This is the first T. And that stands for treatment. Okay. So it's how are you going to treat this, right? And here's the big thing for EMT basics going to EMT paramedic, National Registry paramedic, is that when you're at a standardized exam, especially a standardized exam for the NREMT, they want you to understand how to do things from simplistic to the most difficult. If I wanted to raise someone's blood pressure, right? I wanted to help alleviate maybe some lightheadedness and they were hypotensive, I would lay that person in a supine position. If I wanted to increase blood pressure, okay, and someone was hypotensive, but in this case, this person is hypertensive, okay, hypertensive. So if they have a headache, then I would want to perhaps, if possible, elevate the head, right? Head of bed. I'm just going to put head of bed. I'm also going to maybe put semifallers here, SF, okay? And if they're gestational, you may not be able to do that because that would run into what? What would that run into? Probably supine hypotensive syndrome, right? Because if she's obviously likely to be in her third trimester at this point, then semifallar is probably not going to work, right? So you see how I'm navigating the basic stuff, but we all been told how to treat this, right? We've all been told that the first thing we're going to make sure that we do is we go ahead and lower that blood pressure. Okay, we're going to lower that blood pressure with something like either a labetalol, right, LAB, or we're going to give hydralazine, right? And the other thing, once we transition from preeclampsia to full-blown eclampsia, which that threshold is the seizure, I'm going to put S here. Now we're in eclampsia. Okay. So now this is what you're already jumping to. You're jumping to that conclusion, but you haven't done the 4 pillars of preeclampsia yet. You see, when you do the 4 pillars of eclampsia, then seizures would go into physical exam and assessment, right? Treatment would be that MAG, right? Those 4 to 6 grams. And if that doesn't work, right? If that doesn't work, then you can use lorazepam, perhaps, any benzo. But you have to be careful because that's a pregnancy category D. Most benzos are pregnancy category D. This is why we go with a MAG. Okay, one of the reasons. Okay, so I started, let's go back to preeclampsia here, but I started simplistically. So not supine, but lateral recumbent would be ideal, or recovery. Okay, lateral recumbent. Okay, just depending on her comfortability. But what I'm getting at is, first and foremost, if you see the patient is in distress, immediately you want to make sure that you jump back to your NREMT sheets and those assessment sheets, right? If she appears to be in distress and she's hypertensive, then oxygen would not be a problem. Some supplemental oxygen. If she feels, and if it looks like her heart rate is fast, it looks like maybe she is winded and short of breath, you go back to your NREMT medical and trauma sheets, and it shows you after you're seen size up, you go to your primary, right? And the first thing you can do is, when she's talking to you, she's likely going to be sitting somewhere, right? She's very unlikely for her under these conditions to be standing. So you can have her immediately, right, head of bed, or you can have her lay on the couch or the bed or whatever, wherever she is. But the answer choice from simplistic purposes is position the person, right? Just like you would position an airway, you're going to position that person, okay, to help alleviate signs or symptoms, right? Then you're going to do your ABCs, because this is part of our primary, right? Our ABCs. This is part of our primary. And so what we're doing here is we're teaching ourselves to do things sequentially. And what happens is students, especially advanced or paramedic students, because they have the scope and understanding that they can push medications, or that they are able to push those medications and they have a knowledge of those medications, they're more apt to go ahead and pick the medication that's appropriate, but it's not the first step, right? It's just like putting your gloves on before entering the scene, okay? That's important. If someone is, again, hypertensive, you can fix and lower some of that hypertension by sitting them up, okay? All right. Sometimes positioning them will fix that. Even standing up typically will have a little bit higher blood pressure sometimes. So position is important. And this is something that you would look at for critical care, things like that. You guys should be up to speed with orthostatics and things of that nature. So I know you kind of hear where I'm going with this. But ABCs, if she, again, think about your ABCs. Okay, I'm not going to beat a dead horse there. So oxygen in supplemental fashion, no problem. Okay, if the answer choice continues to ask you anything about that treatment, just be aware that you're thinking sequentially. SEQ, sequential. If you're not doing that, then you're going to get the easy things incorrect. Okay, you're going to think that, oh man, like I thought I did good, or oh man, like, I knew it, but I don't know. And you jump to that medication instead of jumping to the sequential things. And they'll hit you on stuff like that. Okay, so just be prepared. Always sequential. Then you can go to your medications. If they're talking about things like IVs, like what would you do? IV and fluid bolus and stuff like that, or they're asking you about the intervention, it's the same thing. You have to do one thing before the other, right? So if they're asking you something about monitor, for example, then after you do your ABCs, then you can do obviously your monitor, right, and IV. Yeah, monitor and IV. Then you can do your medications. Okay. Here. All right, so just know that this is the train of thought for every time you enter the scenario case. Okay. What's going to help you is going back to the old protocols of NREMT and those old assessment sheets where they have you practice, right, in your school, and then you're going to go in front of a proctor and you're going to do that psychomotor exam. If you keep that in your head, you're going to do well in understanding that sequential order of things, okay, on your examination, and it's going to help you. Now, I'm bringing this to your attention because this approach needs to be used on those scenario cases. And I'm going to go through the last T here and express what this means. And then we're going to go to the scenarios and understand a little bit about how to navigate a scenario using this. Okay, so the second T stands for transport. Okay, transport. This is important for more advanced level, I would say advanced and paramedic, and then your specialties certifications, because they're going to ask you questions about how or where you should go regarding this patient, especially if there's a burn patient, where do you go? Like a burn facility. If there's a cardiac patient, where do you go? Someone with a PCI, percutaneous intervention, or a cath lab. Where do you go if it's trauma and there is greater than 30-minute ground transport? You call it the helicopter, okay, HEMS. For basics and medics in all levels, they may ask you, where would a secondary assessment be appropriate? And that would be usually in transport, right? So if they asked you at the board certification level, when should you double check things like glucose, or what would happen if a particular medication didn't work? Would you administer a second dose? Okay, so this is where that comes in. So if you want to study that, especially the EMTs at all three levels, this is a great way to plug in if there is something pertaining to the emergency that always necessitates a secondary thought process, okay? And whether that even be transfer of care from basic to advanced care, or whether it be someone is coding and we need to make sure that we stop the ambulance and work the code so we have effective compressions and enough manpower and resource to establish effective resuscitative efforts and not transport en route, okay, under some circumstances. So again, they may ask you questions regarding this, and that's where you need to plug this transport piece in, okay? Let's go to another page really quick and talk about the scenarios, okay? Actually, we'll just keep the whiteboard here, and I'm just going to section it off. Okay, so when we're looking at our patients and we're looking at the scenarios on our NREMT, usually the new format, and I was given this exam, mind you, I think back in May or March, and I wasn't supposed to take it. They said the new format was to be implemented in July, and they gave me this format in March, and I was very flustered. So long story short, the new format is quite exhilarating, but it doesn't matter because the scenarios should be done in this fashion. And what this is going to help you do is it's going to help bring you to the next level of confidence and kind of beat down any type of doubts in yourself. So if you're looking at, I'm just going to do this right here, pretend this is a scenario, okay? If you're looking at a scenario and they're asking you about what it could be, right? Like what type of traumatic injury could this be? Let's just say it was cardiac tamponade. Let's just say it was cardiac tamponade, CT. Let's say it was a tension pneumo, TP. Let's say it was neurogenic shock, NS, okay? Let's say it was flail chest, FC. And let's say it was, I don't know, Colles fracture, CF. Just hypotheticals here, okay? So if we're looking at our scenarios, okay, it doesn't matter what level you are. If you're looking at a scenario and they're asking you about a specific emergency, okay, you have to realize that when we go back to our foundational understanding, we have medical emergencies and trauma emergencies. Okay, that's very important to realize because trauma means that we have a mechanism of injury and medical means we have a nature of illness. Okay. Okay, so understanding this and just looking at the very first thing which you should do is look at your answers. Okay, if they have a list of answers, look at your answers before reading the scenario and look to see what patterns you see in those particular answer choices. You see that a lot of this is trauma based. So you know it's trauma based. So we know that there's some type of kinetic force associated with this. Okay, easy peasy. But that's important because sometimes what will happen is they will give you some freebies and they'll throw in maybe one or two medical emergencies. And they'll say something like on F down here, they'll say something like pleural effusion, PE, pleural effusion. I'm going to put FF so you don't get confused. They might put down there pleural effusion, okay? Or, let's see, they may put something like, oh gosh, I don't know. What else can we put? Urethral discharge. So maybe they'll put UTI or something like that. Something kind of strange. Okay. And so what you have to do is immediately is you can look through the patterns and see that, okay, well, these two don't really mix, or obviously they're not going to put them side by side, but they might be different body systems. Like they may not even be musculoskeletal. In this case, it's genital urinary, right? Or it's respiratory, it's pulmonary and genital urinary. So look for the patterns. And the reason why you're going to start this way is because you're going to be able to appreciate that if you did your due diligence and you understand that your 4 pillars and your IT is at the forefront, okay, and you've done your work and you understand how to define these, you understand physical exam findings or assessment findings, okay, and not just those particular findings. I'm going to emphasize not just particular findings, but hallmark physical exam or hallmark assessment findings, right? Whether that be on auscultation, whether it be on inspection, whether it be on percussion. So we're talking hallmark, and hallmark means that we're going to go back over here on the left. Hallmark means that I am seeing a common denominator of that information through multiple resources. So hallmark means that if I were to go onto Google right now and I were to search preeclampsia assessment findings, this area right here, headache, pulmonary edema, or pedal edema, or just swelling in hands and feet as well, just seeing that in multiple sources, ranging from Medscape, Up to Date, Merck Manual, any physician desk reference, anything in your paramedic book referenced by a nursing association, right? Anything that you can put your hands on. If you can pull 3 resources and it says these things, that means that's a hallmark sign and symptom, right? Someone's complaining of something and then you see something. This is vital for you to understand that information. And once you get that information, stick with that information, right? And believe in the information. And then move forward with the information, right? So this is great for categorizing and keeping things in your mind kind of situationally aware. And because you're going to need that to contrast with other emergencies. So keep the hallmark assessment findings, keep the hallmark vital signs, okay, and the hallmark treatments right there in your tool belt, okay, right there in your tool belt. So you're going to come over here and you're going to look at this and say, okay, so you're at your answer choices. You see all these answer choices. You've already seen that we have like medical over here for some reason. And then we have all of this trauma for some reason. Okay, so this is interesting. So you're going to say, okay, well, A is cardiac tamponade. What do I know about cardiac tamponade? And this is where I do my IT. Okay, I'm doing my IT here. I'm saying, okay, well, how do I identify cardiac tamponade? Well, by the definition, we know that cardiac tamponade is that pericardial, essentially fluid that's exceeding, whether it be blood, typically because it's trauma based, that exceeds the pressures, okay, to effectively help the heart relax during the diastolic phase. And so the pressures exceed that, the ventricular relaxation. So why is it happening? Well, it's a mechanism of injury. And so the pressures, again, typically due to blood volume. The normal person has 20 cc's of blood, of fluid, if you will, plasma within the pericardial sac, because we need it, because it's a friction-based area. So we have about 20 cc's. Okay, normally, but once we're in an accident, that all goes to the wayside. And so we're looking at assessment findings, and immediately what stands out, again, hallmark is the whole Beck's triad piece, right? So we're thinking what? JVD, muffled heart tones, hypotension, right? Okay, so then vital signs, I should be seeing those things. The pulse gap should be decreasing. I should get wider. So that's what I know right there. And I use the 4 pillars. Okay, I use these 4 pillars to navigate that. Then I went to tension pneumo. Okay, what do I know about tension pneumo? Okay, late phase pneumothorax, okay, JVD, okay, tracheal deviation, contralateral side, okay, diminished absent on ipsilateral side, okay, vital signs, what's most important hallmark that stands out? Probably on something on auscultation or inspection, which I've mentioned. All right. Neurogenic shock. Oh gosh. Right. The triad of neurogenic shock. That's the hallmark thing that I need to know on physical assessment. That's that what? Everything's down. Right. So you have hypotension. You have bradycardia. Basically, you have loss of sympathetic innervation. Right. Maybe flushed skin. Okay. Maybe pale. It depends on what level. But you need to be prepared to see that, right? No sympathetic compensatory phase. Okay, so I'm going down off of information that I know, but that information, the point of this whole lecture here is to help you understand that the reason why I'm navigating each of these just randomly off the top of my head is because I'm going through my 4 pillars here, verbatim, because that's what you're going to need to be really good at, because this is a licensing certification exam. This is not a course exam that you would find in your course studies, okay, which there's evidence. I used Barron's in my last vlog to help you appreciate that there's a whole amount of literature in the ACT and standardized test prep that explains exactly that. There is a difference in testing in your academic coursework in class versus a licensing exam or a certification exam, okay, because they want you to perform, they want you to be applicable to the real world when you encounter these things. And so they're going to make sure that they're asking you how to identify and understand the possibilities, aka the differentials. Okay, so be good at these hallmark things. Why does this pertain to you in the scenario? Again, we're going over these answers first, because what now, here's what students do is and you get the gist. I'm going to stop beating this dead horse, okay? You get the gist. I'm going to do my IT for these, okay, using those 4 pillars. If you're not good at it, that means you need to go back and study, because what happens is I'll have students come to me and I'll ask them about a particular emergency, and all they can say is JVD, or all they can say is this particular sign, right? Well, guess what? Cardiac tamponade has JVD. Tension pneumothorax has JVD. CHF has JVD. Even cardiac arrest has JVD. Any type of heart failure, which I've mentioned. So JVD is a common denominator anytime you have an increase in central venous pressures. Pulmonary hypertension and pulmonary embolism has JVD, possibly in the later phase. Okay, so the list goes on with JVD. This is why you can't just come to the table and say that one thing. You have to be able to pull. Again, I have it circled here for you. Super important, okay, that you have hallmark understanding. Okay, got it. Circle, really big for you. Hallmark understanding. Hallmark meaning go find in your book. This is why I'm telling you this, because you get overwhelmed by the amount of literature in your book. But really, all you have to do is go through each emergency in your book, okay, and find these 4 pillars. That's what so now you're taking the responsibility as an investigator instead of a victim, okay? You feel victimized, like, man, I have all this work. The reality of it is you're taking the tools and you're going to work. And you're going to use your tools in your tool belt, okay, just like you would in the field. Okay, and then you can navigate that volume, that high volume of information, and go and find this information to help you get ready for the exams. All right, scenario, back to scenario. Okay, we're back to scenario. Why is it important to do your answers first? We're right here. We did the ITs and we understand them well. The reason being is because once I come over here to my scenario and I start reading, I see how long it is. I see that there's some quantitative and qualitative information in here. I see that it's got some names of people in here. I've got some information asking me about vital signs. And then I find out that this is a 2-part or a 3-part question, perhaps. which makes me work from one answer choice on step one and then explain the reasoning behind it on the next question. And so you are even ramped up even more. You're also time constrained because it's a standardized exam. You only have like 2 hours to complete it. And so you're stressed out. You weren't sure about the last question you answered. So you were stressed, and you probably had a bunch of Monster energy drinks and a bunch of coffee. You didn't sleep well, and who knows what's going on in your personal life. So there's going to be students who read this section right here really fast. There's going to be those who read it fast are going to miss some information. This section right here, there's going to be people who read it slow and don't understand the information. There's going to be people who read this section right here, and there's going to be a misunderstanding of the information, which leads them to abstract thought process. They're going to go out to the stars and the moon and consider that this is what the test taker is talking about. This is why we don't read the scenario first. We get nestled in and build our confidence with the test answer choices in this case. Now, our discipline is medicine. Okay, our discipline is medicine. This may not work for other exams, standardized exams, but we're in medicine. Okay, and so this is why you want to read your test answers first, because number one, you're going to build your confidence going into it. It's going to settle you down. Number two, these are your tools right here. These are your tools. There's no other tools. That means you can't abstractly think of what you want to think. You can't say, oh, they must be talking about this. Let me go look at the answer choices. They must be talking about a BVM, or they must be talking about otitis media, or they must be talking about Bennett's fracture, or they may be talking about conjunctivitis, or they may be talking about subdural arachnoid or epidural. No, you can't go and do that. You can't, because this is the tools that you've understood and you've done your preliminary IT on. You can't. So now you're in charge. You grabbed your tools, you went to the scenario, and this is what you got. So now the beauty behind this is that you can take this information in your IT, what you know, and you should go to that scenario, and now you're actively engaged in the scenario, because you're trying to put the puzzle pieces together. And in this case, let's just take cardiac tamponade, for example. And I see cardiac tamponade, by definition, we know what it is. Its mechanism of injury has to be of kinetic energy to the pericardium, okay, which is going to result in some type of fluid entering the pericardial space in that sac, which causes a decrease in performance of the heart, right? The cardiac output, okay? And with that being said, I know that there's certain things that I have to see on inspection. Perhaps it has to be a strike within the center of the chest. I need to have some type of mechanism, maybe a frontal collision. I do see that there's the patient is complaining of chest wall pain on palpation of the either central or even left hemithorax. Okay, I'm seeing, or hearing at least, that I have muffled heart tones. I'm seeing that I have some JVD and perhaps some hypotension. So I'm looking for hallmark vital signs and assessment findings. I'm looking for the inspection that shows that there's been some type of blunt trauma to either the central or left hemithorax in the scenario. I don't have to go through the fluff of the scenario, meaning I may not even have to read the age of the patient, merely because I'm looking for this particular answer. If I don't find those things in this scenario that reflect that answer, I cross it out. Then I go to B, tension pneumo. Well, I know tension pneumo has a pulmonary component to it, right? And in order for that to be true, I know tension is a late phase. So I'm going to double check to make sure we have anything going on our vital signs, okay, or any interventions that reflect a tension pneumo. I'm going to skip, okay, this preliminary information and just kind of look to see if I can plug in my understanding of the tension pneumo in the scenario. Where is it? I'm looking like an investigator, right? And so I take command of the scenario, and I don't sit there and read the scenario and start guessing and make me feel like I don't understand and think that they're trying to trick me and all these other things. So it's not there. I cross it out too. So I cross this out and I cross that out. Okay. So lo and behold, I know with neurogenic shock, in order to have a sufficient amount of kinetic energy to snap my spinal cord, okay, I'd have to have probably a significant fall, which led me to meet some type of velocity, which exceeds the integrity of the infrastructure of my musculoskeletal system, right? Obviously have to have so much impact that I would snap or break something like my spinal cord and fracture my vertebrae. So lo and behold, I see in here that there is something regarding a fall from a helicopter, or an arborist who is a tree cutter was in a 50-foot oak tree. Okay, now we're on to something. Okay, and then how do I find IT in here? Well, IT is telling me that the vital signs are very important, and my assessment very important in understanding whether or not this is neurogenic shock. Okay, so I'm looking. All right, and I see here that we have no compensatory vital signs reflecting someone who has or needs compensatory blood pressure and rate from a fall. Okay. And so I'm not seeing a lot of blood, but I am seeing that I have a substantial mechanism of injury secondary to abrupt deceleration from a significant height. Okay. And this patient obviously will probably be obtunded, if not unconscious. Okay. And I'm looking at those vitals, and I do see bradycardia. I do see hypotension. I do see someone who's not compensating appropriately. And I may have an index of suspicion that because I feel crepitus or I do visualize deformity of midline on assessment of the cervical and vertebral columns, that there is some type of deformity or an indication of paralysis. Okay. This is now why you have to take the time and say, okay, well, this is my number one pick for now. Okay. Is neurogenic shock. And you can keep going down and down and down and down. But the gist of the story here is make sure that you're looking at your answer choices and you're plugging in your IT. This is so important because now you don't have to guess. You have all the confidence in the world. And if you're not entering that answer bank with confidence yet, that means you're not ready. And you need to keep honing your craft and testing your might on your 4 pillars. When you get to that level and you can talk to either your spouse or another partner or yourself or whatever have you, then you're ready to take that test. Okay, then you're ready to go to that scenario, okay, and plug and play instead of reading the scenario and you're having to jump back and forth, trying to do checks and balances, okay, instead of taking the time to understand those answer choices, okay, and bring that confidence to your scenario and you'll blow it out of the park. Okay, you blow it out of the park. So this concludes my live vlog for today. Okay, I hope you guys were able to enjoy and appreciate the tactics for your scenario-based questions. If you have any comments, if you have any concerns, if you need some assistance, then you can just comment, or I'll put my email down, and you guys can get a hold of me. But this is a very fantastic way to help break down your scenario-based portions. And unfortunately, there's going to be a lot of students, I think, with the new format that are going to struggle a little bit because they are either slower readers, or they're going to struggle because there's just a lot of time constraint associated with it. And there's a lot of kind of back and forth, second guessing and questioning yourself. And when they ask you, well, what are the best 2 things you can think of, or what are the best 3 things you can think of, all of a sudden you're responsible for more than just the typical A through D multiple choice. You're responsible for thinking of 2 or 3 things. So if you're not prepared in this fashion, then you unfortunately will be behind, whether it be a lot behind or marginally behind. And sometimes that will add stress. And just being kind of a little behind, that type of stress will impact your subsequent experiences on the next test questions. So be prepared. And this is a great way to prepare. All right. Sebastian, Champ, you have anything to say, Champ? Champ has nothing to say. He says he'd prefer to just relax. Till next time, I appreciate you guys listening. See ya.